Here are shocking dangers of semaglutide on irritable bowel syndrome. So it's not as straightforward as you think. There are studies shown. There's this one meta-analysis study on Rose 10, which is a semaglutide analog. Now we're gonna dive in because it's not one size fits all. It's not just a magic cure, but it potentially can be harmful. I'm Dr. Melissa, a family lifestyle integrative psychiatry doctor, to not only give you the facts, but also the benefits and warnings of certain medications, supplements, and fads. Irritable bowel syndrome can be disheartening because it's unpredictable, with bloating, stomach pain, and even constipation, where you can't go for days, and loose stools, up to 5 to 10 a day. And it's really hard to get through those days and even go to work or social occasions. Of course, we are diving to potential solutions. There's some medications that work and that may not work. Some may work sometimes for 1 month, but maybe not next year. Yes, I love food as medicine and using plant-based eating to help this, which often does the trick, along with moving, having better stress regulation. Now, the current research is on Rose 10 specifically. Now, looking closely at the research, you may get more nausea, more vomiting, and even nightmares. So be careful when trying this medication. And you might not even find this medication. Some GI doctors may not even have access. And a lot of GI doctors don't even know of the latest studies. In the studies, Frontiers in Endocrinology, you will find this paper that just got released March of 2025. It showed that Rose 10 at different doses, 100 to 300 micrograms, could potentially help IBS, pain, and symptoms. However, those who participated in the study also complained of more nausea, vomiting, and even headaches. Hence, it's important to try it if you've tried everything else, such as lifestyle, supplements, and other medications. It can potentially help you, but know that there are risks. And you want somebody to help you understand the potential pros and cons, and who understands the blend of the holistic healing along with this powerful medication. Also, what the studies did not emphasize is the fact that some women complain of headaches. So be careful when taking this medication. I do believe that this needs better studies, more research, and dose options. I like to start my patients on lower doses when it comes to semaglutide, changing the frequency, the amount, and duration, because it's not one size fits all. Bottom line is that there potentially can be negative side effects when using this medication without knowing the research, the dosing, and the potential side effects. So if you're curious and want to learn more about IBS, lifestyle interventions, or medications, share, subscribe, tell a friend, or let me know, have you tried things as semaglutide, GLPs, Wegovy, Ozempic, Mondala, Zepbound? Have you noticed any benefits on your gut health, your digestive health, GERD, IBS? I want to hear it all because I want to be open, because it's, yes, science, but also your story matters. I'm Dr. Melissa and can't wait to hear more from you, and also see you next time.